Hello, my name is Kayla Milhone, and I'm here to tell you more about my oral health program. So step one, we're going to start with the target population. So my target population is second grade students ages 7 to 8 years old at Rolling Hills School District in Guernsey County, Ohio. So Rolling Hills consists of two elementary schools. We have Byesville Elementary and we have Sechrist Elementary. There's roughly about 180 students in second grade. Um, I would say about more than half qualified for Medicaid. So there's a lot of students that we can try to target at these two elementary schools. Also, our main goal is to seal 6-year molars on ages 7 to 8 years old. And obviously, we would go through like a screening process to where we see if they're like within the income level kind of thing. Do they have sealants already? So we wouldn't have to do those students that applied for it there. And then of course, are they already on Medicaid? Are they eligible for, free lunches, that kind of thing. So just a bunch of screening we would do before we picked our group of students. So the reason why I chose this specific target population and students is because not only is Rolling Hills, where we live in this school district, but also it's a low socioeconomic population in Southeast Ohio. And we also have limited access to healthcare and many, many financial barriers to dental care. So those are the main reasons why I chose second grade students at Rolling Hills for this sealant program. So moving on to the determinants of health, I had talked about mostly in my community is education, unhealthy behaviors, access to healthcare, and poor economic stability. So when I think of education, basically just the whole system of education, we've heard of education reform, so that's a big thing. So one of specific example that I had talked about is the Department of Health and Human Services. So this is what they say. So children from low-income families, children with disabilities, and children who routinely experience forms of social discrimination, like bullying, are more likely to struggle with math and reading. So my specific example under education is bullying. You wouldn't think that it would be like a determinant of health, but it kind of is. So if students are being bullied, it's a problem. It's a problem in your community, and we don't want that. So I think that if we increase like the student teacher ratio, I think that would help maybe catch the bullying before it starts. I think that's a good way to maybe change that. So, which leads me to like poor health choices. So there's a lot of kids that eat terrible things, meaning they eat unhealthy stuff, McDonald's all of the time. Maybe they're drinking Mountain Dew. Maybe they don't have like really nice like balanced diets at home. So those are poor healthy choices and unhealthy eating behaviors. We don't want that, but unfortunately in Guernsey County, that's definitely one of the big thing that I see in my patients is they don't have good diets, and of course they're starting to become obese. Which leads me to this. The Department of Health and Human Services say many children and adolescents in the United States have obesity. Obesity is linked to a higher risk for diseases and conditions like high blood pressure, high cholesterol, diabetes, asthma, anxiety, and depression. So, with all of that, not only does obesity cause many health conditions, but also more children are more likely to be bullied in school because they are overweight. So again, we're going back to the bullying. It's not a good thing to do, and of course we don't want we don't want these children to be overweight, like into adulthood. So we don't want that. Another topic that I had talked about is access to healthcare. So in my community, we do have like a newer public health clinic. It's called Muskingum Valley Health Centers, and it's grant funded, so they get a lot of money from the federal government. And they accept all types of insurances and things like that. However, there's a big shortage of doctors and nurses and even dentists there. So there's been times where I've waited like 3 hours just to be seen, and you hear a lot of the staff saying, well, we just are understaffed. So that's a big, problem in my community as well. So, while the healthcare access is there, they're having trouble seeing the population of patients because it's like overpopulated, and there's so many people that need to be seen. People are having to wait longer, and a lot of them, they wait and they can't even afford, the bill that they're going to be getting. But that's another topic too. The last, which is kind of leads me into my last one, which is the economic stability. So, like I said, we have a lot of health services in Guernsey County, but it seems like finding employees that will stay there is a challenge. And one of the challenges is because we are so rural that the pay here isn't that great. And I'm not just speaking for myself, but also for like doctors and nurses and things like that. They definitely go to like the bigger cities where they get paid more money, which makes sense, but it just sucks for, it's just a disadvantage, I should say, for my area or Guernsey County, because that leaves the people here, trying to have better care and things like that. And it's a lot of times it's a shortage of care, and people are longer wait times, that kind of thing. So in summary, to sum all that up, my target population is second graders, 7 to 8 years old. We're going to try to seal all 6-year molars at Rolling Hills Local School District in Guernsey County, Ohio. And there are many determinants of health in my community, but I just told you a couple or a few of them. So I think that answers the step number 1. Thank you for watching.